Controversial rule preventing gay men from giving blood goes into review this morning. Juliana Goldman is at FDA headquarters near Washington, where a panel is taking a second look. Juliana, good morning.
Good morning. It's a long-standing federal regulation that many in the gay and medical communities say is discriminatory, and advocates for change will be gathering here later today to press the FDA to revise its policy. Jason Cianciotto remembers sitting across from a nurse at his high school's blood drive when she asked him a surprising question.
She said to me, "Have you ever had sex with a man since 1977? And at the time I was closeted, I was scared of family rejection. I didn't understand why she was asking me that question.
His answer disqualified him from being a donor then, and it still holds today. The result of a rule put in place at the height of the HIV/AIDS crisis that bans men who have had sex with other men from donating blood. When the rule was imposed in 1983, regulators wanted to prevent HIV from infecting the nation's blood supply. At the time, the disease was known as gay-related immune deficiency, and doctors believed that gay and bisexual men had a higher risk of contracting the virus and other infections such as hepatitis B. But now, with scientific advances in the field of blood testing, a number of medical groups and gay rights activists say the ban is discriminatory, and they are pushing for the Food and Drug Administration to lift it. One of those groups is the Gay Men's Health Crisis, where Cianciotto is now the director of public policy.
This change would help end the stigma that is driving the HIV epidemic among gay and bisexual men in this country by causing shame and fear and lack of a scientific understanding of what causes HIV transmission and what people can do regardless of their sexual orientation or gender identity to protect themselves.
One of the recommendations the FDA will consider comes from an advisory panel for the Department of Health and Human Services. Last month, it said blood safety could still be maintained under a revised policy and recommended allowing men to donate blood provided they haven't had sex with another man for 12 months. That proposal is backed by the American Red Cross and America's Blood Centers and mirrors a year deferral for all other people who have had sexual contact with someone with HIV or viral hepatitis.
The National Blood Bank.
Dr. Lewis Katz is the chief medical officer of America's Blood Centers. He says new tests can detect the HIV virus within 9 days of exposure. Why was it a risk then, but not now?
Because our donor screening approach and our ability to control units with abnormal test results is orders of magnitude better than it was then. Now, the safety from HIV and hepatitis is really many orders of magnitude better, and those infections are all treatable.
According to a September 2014 study, a 12-month deferral could add about 317,000 pints a year to the U.S. blood supply. If the ban was completely eliminated, an additional 615,000 pints of blood a year could help 1.8 million people. That would increase the blood supply by 2 to 4%. But Dr. Katz says any increase is welcome and ultimately fair to all donors.
From the standpoint of the risk assessment, I think it's scientifically and medically right, and that's the way we should make policy.
The panel is expected to vote later today, and people who've been following the issue closely say that they'll likely adopt some sort of change. But Gail, any changes could take at least a year to implement.